Hey you guys, Myloreal here with Tab Training Academy. I'm standing with Dr. Brian. We're going to talk about the Crumpler bag. And yes, I got that name right. I've been practicing for all morning to make sure I got it right, y'all. So Brian, talk to us about this bag.
All right, so this is our second level bag. We already were introduced to the James Durham bag, which is it's our everyday carry. This is going to be a little more extensive. You're going to have chest seals and hemorrhage control in addition to everything you received in the Durham IFAK, which would be a cap tourniquet. You're going to get a SAM splint in case you have some broken bones that you need to splint. We're going to get a roll of tape. We're going to get Celox, right? Celox is a bandage that is impregnated with, for lack of a better term, crustacean shells, and it causes coagulation, which means the bleeding will stop. So something definitely you want to use in packing wounds, especially deep wounds. Do recall, we do not pack the box, so we're not going to pack from the neck to the belly button, but they can be used on extremities and can be used anywhere else, neck, axilla, all of those places, okay? So Lee Crumpler is the first African-American female in 1864. She graduated from what is now Boston University Medical School, and this bag is named in her honor. So we'll deconstruct it for you. Again, this is your SAM splint. You're going to get a 24-inch SAM splint in this one. Again, it is an aluminum-based splint covered with foam padding. You'll get a Cat 7 tourniquet, newly packaged, of course, with expiration dates 3 years in the future. Remember, this is a one-time use. You get a 4-inch roll of gauze. You get a triangular bandage. You get 2 6-inch bolts and 2 key rings. And I'm going to tell you guys what this is for later, but this is what's called an improvised tourniquet. And we'll be using that when we use our commercial tourniquet initially. If you come on multiple trauma, you may have to triage and say this person needs a tourniquet, someone else may need one, but you'll have this as a backup, okay? This is your Celox gauze, very important to have, anti-hemorrhage. We always put in a hand warmer and an emergency blanket. Mylar blanket is what it's called for hypothermia. You get a pair of Trauma Shears. You get a pair of nitrile gloves, and they're nitrile because, of course, we don't want to have people being allergic to latex gloves, so we try to stay away from the latex. You'll also get a marker to date, time, and stamp your tourniquet, all right? In the Crumpler, you're also going to get chest seals, okay? So for occlusive dressings, remember we talked about not packing the box. In the box from the neck to the abdomen, we're going to use chest seals to cover up any gunshot wounds or penetrating wounds. Here's your Mylar blanket, very good to prevent hyperthermia. Hypothermia will kill even in heat, okay? I know that doesn't sound appropriate, but it is. If you lose blood volume, you're gonna be hypothermic. Again, another ETD, emergency trauma dressing, a 4-inch. Your duct tape, which can be used for various and sundry things. We can even use the wrappings from these packages as chest seals that are improvised, along with, you know, this tape. You got chest seals just using the packaging. I've had paramedics tell me they've used potato chip bags and Dorito bags and cellophane and anything that you can use to make a 3-way occlusive dressing. What we include in each pack also, some stickers, one of my cards, and the large sticker can actually be used as an improvised chest seal. Okay, that's why I keep that in there. But this is, again, your Crumpler bag. It's going to be a step up from your Durham bag. This will be something that you keep in your backpack, on your person, or in your truck. All right?
Absolutely. So there you guys have it, from the myth and the legend, Dr. Brian himself. Make sure you guys use my discount code TAB15 to get 15% off of his products.